So we've all been on the ward throughout the whole COVID period, and we've learnt a lot and we've experienced quite a lot. I'd say the thing we're most proud of is working together as a team. Yeah, we really came together as a team. Everybody got really involved and really just got each other through it.
Including junior doctors, physiotherapists, occupational, everybody, absolutely everybody.
Consultant teams, Sodexo staff, absolutely
Housekeeper.
everybody.
We all had to adapt and we all worked really well to keep morale up, even though we're all sort of stuck in here.
Yeah, we've had some good laughs, didn't we?
Yeah.
100%.
But it was really difficult. I would say the most difficult thing was the restrictions on visitors, and obviously we had really, really sick patients, and having to call family members every day. You got really involved. We know them all on a first name basis. We still remember them all.
That's very true.
Yeah,
and updating them and saying that you can't see your family member.
Especially when they were unwell
Especially when they were really
they
unwell.
couldn't come say bye, you know. Or
That actually reminds me of my most striking memory, which is receiving a phone call from family members and then having to be that conduit to be like, this is the last message, this is the last thing we would like you to do on behalf of our loved one. That was quite hard. I've had
a few ones like that too.
tell people that other people love them. I've had to stroke people's hair. It's been tough.
Yeah.
Literally be there as the last person they see sometimes.
Yeah.
Because family members would also have to consider them coming in was such a risk to their health as well, and they had to weigh up that decision, and explaining that to them and watching them make that decision was just agonising.
Yeah.
And passing on someone's last words is just, it broke your heart really.
It really does.
One of the things that I'm most proud of is how the team worked together through all the changes. At one point it was changing hourly, and we just constantly worked as a team, and nothing seemed to be an issue for us.
Everyone just paired together and got on with it straight away.
One of the things that was most difficult for both of us, I think, and for the whole ward was the fact that we couldn't have visitors and family members, and that was a very hard time making phone calls, sitting with patients, just a very hard time as staff to deal with something like that.
For staff and watching our patients obviously want their family members and having to tell them as well that we weren't allowed to bring the visitors in, and doing everything we could to support them through the hard times.
So I think this time has been it's been difficult for everyone, but especially our department. Some of the things that I've been especially proud of with our department is like just the willingness to keep going and keep providing care, even though the situation's been evolving and we haven't really known what we're facing. I think one of the more difficult things has been just relatives not being able to come in, having to tell someone over the phone that someone's passing away. At least if you did it in person, you can show a bit of empathy, but doing it over the phone was horrible.
Adding to that, I think the most difficult thing about all this was actually like being there to see like medicine in itself like hitting the lowest that it would be. I didn't even think that we'd reach that point wherein we'd be essentially at some point like playing God. And the most striking memory for me is going home almost every day feeling defeated, because I mean this profession is meant to help heal, help people live, help people recover, but every day I was just going home, like all of us are going home and feeling like we haven't really done any of that because COVID was just not having any of it. But every day that I come into work, my team, everyone, doctors, HCAs, nurses, they're like, come on, let's get to it. Today's a brand new day. Today's a new day. We'll get somebody out of here. We'll get people to basically move on from this. And then tomorrow, today it's a brand new day. I mean, it can't rain forever, so we'll just go and push forward.
Mm-hmm. I think I find the most difficult thing that happened in the last 2 months is coming to work and going home to my family. thinking about whether or not I'm going to bring the virus with me. My wife and I are both nurses, and there's always that thought for the last 2 months, what's going on, what's going to happen, and I think just being confident to come to work. I think our mindset back then was that if no one's going to do it, who else will be? So my wife just like had that courage to come to work, making sure everyone is safe at home. If there's one striking memory that I can think of was that the first 2 weeks when this all happened, we had the redeployments here, and they haven't been to a medical wards. And we also have newly qualified who just got their PIN in the last 6 months. And it's just building up that confidence with them, reassuring them that they're safe and that they'll be able to carry on with their job. And I just felt back then that it was a shining moment for Frome, having to look after patients in the most, I would say this would go down in history as people will remember this. And we were proud to be part of it.
And I'm most proud of this team, Team Frome. They've done an absolute brilliant job and couldn't be more proud.
We've obviously both been working in the areas of the hospital where we've been solely treating the patients who've been COVID positive. I think probably the thing that we're most proud of, what I'm certainly most proud of, is the way that everyone has pulled together. We redeployed essentially our entire department to make sure they were coming to areas where they were going to be the most needed, which obviously was primarily here and intensive care, and everyone pulled together with no fuss, no drama, and it was just a huge, huge team effort, and I'm really, really proud of that.
I think something I'm most proud of is the physios coming from different areas, upskilling and just getting on with it, like getting stuck in, and also seeing patients be so poorly on ITU and then come to Frome and everyone, you know, got together and pulled together as an MDT and rehab those patients, and actually seeing those patients go home and see their families was just the best feeling.
Yeah, I think this whole process has very much highlighted that all patient care is a huge team effort, and actually I think this has highlighted it probably most kind of starkly out of any kind of pandemic I've ever worked through before, because it has involved every aspect of patient care. I think particularly because there are no visitors, so you're having to do a lot of the kind of family support that you'd normally be able to get from patients' family and have those conversations, and I think it's almost made it almost more patient-centred than any kind of care we've ever done before. Trying to do all of that in full PPE has probably been the most difficult, because I think we don't ever realise just how much we rely on all of our non-verbal communication skills and kind of patients being able to see our faces, particularly those that are hard of hearing. Trying to talk to them when you've got an FFP3 mask on is really challenging. It's hot, working with those gowns on is not particularly pleasant, and that, you know, when you're in it for, you know, anything up to 12 hours a day, that's been really tough. And yeah, it's not something that we'd be keen to repeat every day.
I think what I'm most proud of over this whole COVID-19 situation is the way the team came together in a really difficult, evolving time. Everybody rallied around each other and I think supported each other really well, and so I'm really proud of that. I think probably one of the most difficult things for me was seeing my colleagues here and on other wards just so scared and anxious about the situation, and again I think that comes back to not knowing what's going on and things changing so much. I think my most striking memory throughout all of this is when I first came back onto Frome after lockdown happened, and seeing my colleagues who I'd worked with for all this time suddenly in full PPE. That was really quite a difficult moment.
But on a more positive note, I'd say that some of the changes that we made that we'd like to see is we achieved an excellent sort of continuity of care. We had a 7-day service that was 8:30 till 9:30 at night. We looked after our patients Monday to Sunday.
And it worked really well, didn't we?
It worked really well.
Consultants were on the wards, and we felt like we really got to sort of see through the patients.
The consultants were amazing, honestly. And I think it gave the rest of the hospital, who maybe were a bit afraid of Frome and COVID and didn't have that sort of exposure that we had, it sort of gave them a break and allowed us to just do what we could.
Yeah.
Yeah.